Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, along with my producer, Lindsay, and we are streaming from downtown Kennewick, Washington today. And we have Dr. Ross Carter on the line all the way from West Palm Beach, Florida. You don't want to miss out on this show. We're going to be talking about lots of cool stuff: regenerative medicine, stem cells, nanoparticles. What else are we going to be talking about, Dr. Carter?
Well, you pretty much nailed it. Those are the main topics that we're going to talk about. Exosomes too, but you'll understand. We'll delineate everything so that's really clear.
And let me just keep introducing Dr. Carter. He is a best-selling author. He has a book. What is the name of your book, Dr. Carter?
Well, the current book that I have is The $1 Million Business Card. The book that's coming out in about 2 months is called Healing Your Weakest Link, which it's going to be very groundbreaking, controversial information, but it's going to all be research backed, but it's got a really interesting concept. But this is my $1 million business card. So if you have a business, you have to build credibility, because we all need to get attention for our services. And this book tells you exactly how to do that. But the concept is really straightforward. You write a book. You need to write a book, a specific kind of book that really accents who you are, why you're special, what makes you unique, and that really gives you credibility in any industry that you're in. And I use this for my own self in my practice, and it really built up my practice. You know, one little technique I'll give everybody. This is an awesome idea to do, by the way. You can look up let's say you want to concentrate on rich people or celebrity even. You can find out their address, either like their home address or their business address. And you can even look up their birthday usually and find out when it is. And you can gift a book in a little gift bag around their birthday or during a holiday. And who's not going to open that? Everyone is, right? And usually it gets through the gatekeepers. That's the thing. Because if you look for a high-end person, I've worked with a lot of them, they have gatekeepers. So they'll filter all the mail and stuff. But if it's a present, they're not going to open it, right? So they'll open up a Amazon thing, and it'll be a gift bag, and there'll be a little card, and they'll be like, oh, that goes right to them. And they give it to them. And so you can put your message right in front of celebrities, high net worth people. It works great.
That is a wonderful idea. And that reminds me, yeah. And that reminds me, I've sent out a lot of books, even personal signed copies to, celebrities and people in the industry that I want to network with. And I wonder if it ever gets to them. But you're right. If you gift it as a wrapped gift from Amazon, they will probably open it themselves. That is a wonderful idea.
Yeah.
Yeah. And you also have a successful podcast. Tell me about your podcast.
Well, the podcast is called the Regenerative Warrior Podcast. There's actually two. There's a show and a podcast. The show is more for the general public. So it talks about the newest in recent research that advances. That's it. And that's the podcast. That's actually designed more for the medical professionals and how to improve their practice and learn about the most advanced techniques to add services to their practice. The show, which is more of a YouTube show, it goes over the newest research that is available that we as consumers or people that want to stay healthy can utilize. It talks about any of the newest stuff that they find, and there's amazing things like 3D printing of body parts, things like that. It's pretty amazing stuff.
And also, you run a very successful clinical practice. So what's the name of your clinical practice?
The Longevity and Wellness Institute in Palm Beach, or we call it Doc Stem Cell of Palm Beach, is easier to remember.
Yeah, so, that is much easier. Yeah.
Yeah. So we go by Doc Stem Cell of Palm Beach. And so I basically, we do all type of regenerative stem cell related procedures, whether it be a PRP, we'll use bone marrow, adipose tissue stem cells. We use placental tissue stem cells as well. We'll use exosomes, which are the particles that make stem cells active, and the active ingredient, really. And we do all these things to help treat joint pain, health problems, systemic issues, autoimmune conditions. I mean, pretty much any kind of dysfunction of the body, we can use regenerative procedures to help.
So let's back up a little bit and just let's define what regenerative medicine is and tell us a little bit about that. And then we can get into the details that's underneath it.
Sure. Regenerative medicine really is using different types of techniques to stimulate the regeneration of your body's cells. Our health is determined by the health of our cells. So if your cells are unhealthy, you're going to be unhealthy. Just that's how it works. Our body has a constant process of renewal. Like our blood cells are constantly dying and being replaced. And our hematopoietic stem cells are doing that from our bone marrow. So they're replacing all the cells. Our skin cells are constantly being replaced. So what we're doing with regenerative procedures is we're supercharging our own regenerative system so that it can repair faster or quicker or better.
Okay, so all right, so that's a broad definition of regenerative medicine. So now let's get into some of the details of it. Stem cells, that's even in your name of your practice. So tell us about stem cells and how they can be utilized to regenerate.
Yeah, absolutely. Well, I guess for me, it goes back about 10 years. I got involved in regenerative medicine and stem cell because of an injury that I had sustained. So back in 2011, I wanted to get, I was single and I wanted to meet, girls, obviously. And so I thought to do a recreational sport, which is a great place to meet a bunch of people, right? And so there were choices like there was kickball, softball, maybe soccer. And then there was something that really stuck out to me, which is dodgeball. You remember dodgeball? Right? Well, at the time,
you didn't.
Yeah. At the time, I thought I had remembered when I was like a little kid that it was so much fun. And so I joined the dodgeball league. Now, come to find out that when you take a red plastic ball and you smack a girl in the face, it is not the best way to find a girlfriend. Who would have thought, right? So dodgeball turned out to not be the best choice for a 41-year-old to make new friends. Plus my body wasn't. I thought it was in great shape. I work out all the time, but my body had not been used to this sport. And so one of the games, I threw a ball, I ripped my ACL. So I hobbled off the court, and that was the end of my dodgeball. And I had 2 large rehab centers at the time. So I was rehabbing my knee. It was getting better to some degree, but it was always weaker. I don't know if anybody's listening knows how a knee injury is. It's just like it can be constant and it won't go away. And then you favor your other leg. You kind of walk a little funny. You're always worried about doing special types of lateral motion or things like that. At least that's what my experience was. Eventually, I got to the point where I was like, this can't work, because keep in mind, I have a rehab center, right? I'm not going to walk kind of weird up to somebody and say, hey, we're going to fix your problems when I hadn't even fixed my own. Right. So that didn't work. So I said, look, I got to get this thing fixed. It's getting ridiculous. And I went and got an MRI and went to an orthopedist, and he said, okay, well, you tore your ACL. You're not going to rehab that out. That's something you got to get surgery for. And I had seen so many people that had surgeries for knees and joints in general, and they've just never turned out very well. I mean, if at best, a lot of them they were better than they were with the broken, with the torn problems, but they were never back to normal. You know what I mean? They were always, and they would have to go in and have a revision, and they would have to have more surgeries. Anyway, so I just said, I am not doing this. I'm just not going to do it. And then I started doing a lot of research on what other things I could do, because there had to be something between physical therapy and surgery, right? There had to be a gap, and I thought there was. And there was, it turned out. And I learned about something called stem cell therapy. Now, that's what it was called at the time. And the only thing, this is 10 years ago now, I had only heard negative things about stem cells. Like, George Bush had signed that law saying we're not going to fund, the embryonic stem cells. Right. They had cloning of animals, and, they were doing all these weird things. Yep. And I was like, well, wait a second. So what I was reading was they were using stem cells to actually work on a person like a normal person, not in a research, but as a therapy. So I was like, well, wait a second. It happened to be in Thailand. It wasn't local. And so I was like, you know what? I have to get this done. And I had some time off. So I was like, I'm going to Thailand. So I spent 3 months in Asia, South Asia, which was amazing, by the way. And I learned all about this procedure called stem cell therapy. What I found out is they were injecting bone marrow stem cells from your own body into joints, and it was helping that area stimulate the healing response without surgery. And it was working on backs and knees and shoulders, and everything was getting great responses. So I decided this is the solution. I decided not to do my own bone marrow. I did something called placental tissue because there's no surgery involved. And I was 41, I was 41, 42 area. And I was like, maybe my cells aren't going to be as strong as they would when I was young. So I decided the placental route would be my choice. I did one injection in my own office with my nurse. And a month later, I was my normal self. Never had surgery. Still not today. I'm a runner now. I do everything, and it totally healed me. And I became a huge advocate. I was like, this is life-changing, because I've been doing rehab for years with lots of patients, but rehab has its limitations. Right. And so I was like, this is something that I can't believe is available. It's just amazing. And no one was doing it in Atlanta. Nobody. And because I couldn't find it. And then I was like, well, we're going to do it. So I opened up what we called it Stem Cell of Atlanta. It was a small clinic. And then we just expanded it into this the largest stem cell specialty center in the South, actually. And we just started treating everybody in Atlanta. And it was just amazing, the results we got. So that's how I got involved in stem cell in the first place.
Well, congratulations on doing that and helping so many patients. And I will say that a lot of times these journeys start with, us personally, and it changes our lives. So then we want to change other people's lives. And fortunately you had the ability to do that. So kudos to you for doing that. So let's talk a little bit about some other things that stem cells can do. So, rehab or, for injuries. So what else can stem cells do?
Well, they can really stimulate the healing or accelerate our own natural body's healing ability. So here's the misconception that I thought, and most scientists thought back 10 or more years ago. My understanding was we would take a stem cell, inject it into an area, and those actual cells would start to create new tissue, right? That's what most people still even think. Mm-hmm. The problem is that's not how it works. What happens is when you transplant cells from another part of the body, or if you get it from placental tissue, and you stick it in a damaged knee, for example, like in my case, what it does is this. It sends out signals to the local, what are called progenitor cells. Now, the progenitor cells are the ones that actually make the specific tissue. And each tissue has its own progenitor cells. So you have progenitor cells that create ligaments and cartilage and muscle and bone, and all those are specific tissue lines. So a stem cell goes into that area, and it's like a foreman on a construction site. So it's in the middle. Think of all these construction workers all surround this guy, and he's like, you do this, you do this, you do this, you do this. But it's just simply sending out the signal. So it surveys what the problem is, knows what to do, and then tells those local progenitor cells to start to fix their tissues. Because as we get older, our cells, our repair cells, become more dormant. They just stop working for whatever reason. They become lazy, I guess. But so we've got our local regenerative cells just don't start work as well as they did when we were young. So these stem cells come in and wake up our repair system and say, hey, there's a problem here. Wake up. We need you to work. And then they'll start the repair process. If it's possible. Now, it can't solve every problem, but it can stimulate the regeneration of a lot of problems that normally would not be able to be helped. So, and it uses this it sends a message. And this message has the instructions of what to do. And it's not a text message, but it's a chemical message. So you got a cell, and it wants to talk to another cell, and it's going to send a message from one cell to another. It doesn't do it electronically. It does it through this little tiny bubble. It's a little tiny bubble, 100th the size of a cell. It enters, it goes to the stem cell to the other cell. It has the DNA or the RNA, the messenger RNA, and that is the recipe for a protein. So then the cell that's there starts to create the proteins that stimulate the tissue regeneration. So that is called, and those little tiny bubbles are called many different things: extracellular vesicles, exosomes, nanoparticles. So those are what those yeah, exactly.
Okay.
So they're called many different things. So those little particles are what makes a stem cell do its work. Okay. And most people don't even know right now, the entire world is going through what's called exosome therapy right now, or nanoparticle therapy. It's called our vaccine. What is our vaccine? Our vaccine is a messenger RNA that is encapsulated in a protective capsule, which is called an exosome. And that capsule with the message goes into the cells. It stimulates the cells to make what's called spike proteins. And those spike proteins stimulate the immune system to attack it, recognize it for the future. And so when you're exposed to a virus that has that same kind of signature, it's supposed to attack it. Now, I am not one to advocate or deny the vaccine. So that's not where I'm going with this. I'm just explaining the science behind the vaccine of how it's supposed to work. So,
well, and let's just clarify, because sometimes we talk so general because in this, but when we say vaccine, we're talking about the COVID vaccine.
Yeah, sorry.
You said the vaccine, and that is so general, but I know because it's so prevalent in society right now, we should just understand that. But let's just make that clear. This is for the COVID vaccine.
The COVID vaccine.
COVID-19 vaccine.
Yes, and it's not the flu vaccine and all that, because they're using deadened viruses.
Correct.
This is actually using a messenger RNA, which makes a protein. And we use that already. That's how stem cells function. They send the messenger RNA of the stem cell, which is pro-growth, anti-inflammatory. Those are the message that it's getting. So it takes down inflammation. It modulates the immune system. It stimulates the cells to stimulate the production of new cells and new tissue. So it replaces the damage that is there. And that is how you heal. And that's how a stem cell and really the exosomes work. So what they found was, you can take a stem cell and stimulate it in a lab to produce exosomes. And then you could just take the signals and concentrate those signals without the live cell and inject it in the person and have the same effect. And that is nanoparticle therapy.
I see. Okay. So it's from the stem cells, concentrated part of exosomes from the stem cells.
Right. The nanoparticles are just the actual RNA. You've got micro RNA, you have messenger RNA, you have growth factors, you have proteins. All those things are encapsulated. And then capsule is just to protect it, because when it goes out of the cell, it'll degrade very quickly. But if it's protected and then it goes to another cell, it can enter the cell easier. If it's just shot out of a cell, then it won't work at all. So the capsule is called an exosome. It's really just a protective bubble. It's the contents that we're talking about, the nanoparticles, because all cells create exosomes. Cancer cells do. And you don't want those exosomes because they're sending a different message than something regenerative, right? Your urine has exosomes. Milk has exosomes. All these different areas have their own exosomes, their messages. So we're using a regenerative message, and that's from a stem cell, from a mesenchymal stem cell. That's a very specific type.
Great explanation, Dr. Carter. Thank you so much for that.
Yep.
I definitely learned a lot, and I'm sure our viewers and listeners will. Okay, so stem cells versus PRP. Educate us.
Perfect. PRP is called platelet-rich plasma. That's what it stands for. And the way we get platelet-rich plasma is we take a blood draw and we spin it down into its layers. There's kind of two layers. You've got your blood cells and your plasma. All right. There's a middle layer between those two, which is called a buffy coat, which is kind of a creamy color, and it's a concentrations of the platelet-rich plasma. That is the concentration of your growth factors. So you remove the plasma, you remove the red blood cells, and that little concentration is really that basically allows your body to normally heal itself. When you cut yourself, that's what goes to that area and stimulates healing. So we're taking a concentration of that and we're utilizing. Now, so you can utilize PRP for joint problems and other problems because it stimulates an acceleration of your own body's natural healing. That's how PRP works. The challenge with it is, as we get older, our own growth factors' ability to do the things that they need to do goes down. So it's just not going to be quite as responsive. Plus, it stimulates inflammation. Now, a stem cell decreases the inflammation. A PRP stimulates inflammation. So one of the biggest problems we see is when we inject PRP into a joint, it becomes inflamed and hurts like crazy. So that's a very common problem. Now, it does stimulate regeneration, but to some degree, but you're using your own regeneration, and it can develop into scar tissue because fibrous tissue is easier to create than the other tissue that is there. It doesn't talk to the other cells to stimulate them to regenerate their own tissue. It just stimulates a kind of a patch job. So you can get a lot of scar tissue buildup with PRP. So stem cells are more the regeneration without scarring, and PRP is more inflammatory, and it will have scar tissue. But it can help heal an area, just may not be the way you want it to be healed.
So is there ever if you could use stem cells, would there ever be a reason to use PRP over stem cells?
No, I would not. I would mix them.
Okay.
Definitely using combining these therapies works really, really well because, if you're taking some growth factors and you're using some stem cells at the same time, it's going to accelerate everything a little bit more. So I would use them in combination. Like when we do hair, we do work with hair, then you can use PRP in combination with stem cells and maybe some amniotic fluid. There's various ways to do that, but yeah. So I would use it.
Okay, tell us a little bit more about that. Details with hair. What do you do with stem cells, PRP, and hair?
You're stimulating the follicles to start growing again. Whatever the reason, whether you have too much DHT or whatever, the follicles just won't be growing. So you have to have follicles there. It's not going to implant them if you're looking for that. It will stimulate what you already have to start to grow better. And you can use, and it's just a stimulant.
Even if the follicles are dead, it will stimulate them to start working.
Dead, if they could be dormant. So
okay, there you go.
Dormant is different. If dormant means they can come back alive. If they're dead, they're probably not. There's nothing there, so they're not going to do anything.
Right.
So that right now they've got a lot of new drug applications for the use of exosomes or exosome type of therapy, which is those little bubbles in hair replacement. So it's a less painful procedure than doing a complete hair replacement, but price is a little prohibitive right now. It's a little costly. That once the price comes down, it'll probably be a lot more popular than like a hair transplant, which is a really painful procedure, and it can be $20,000-$30,000. So right now it's a cheaper alternative, but it may not give you this. It's not going to give you the same results as a normal hair transplant will. Not yet.
I see. And that's the stem cell PRP combination?
Yeah, they've got different protocols in regards to that. You can use amniotic, you can use PRP. Anything that stimulates the hair to wake up and start to grow again.
Awesome. Well, thank you for that tidbit. And let's move on to peptides. You're familiar with peptides. You use peptides. Tell us a little bit about peptides. They're kind of in the news a lot lately. I get a call probably once a week at our pharmacy asking about peptides. Peptides
they're a really diverse. They have so many uses. We can use them for. Let's define a peptide first. A peptide is in essence, to make it easy, a short protein. So a protein is a 3D structure made of more than 50 units of amino acids. If it's less than that, from 2 to 50, then it's called a peptide. And it does stimulate signaling of cells, and it can stimulate very amazing responses of our body. For example, you could use something like BPC 157, which is one of the most popular and well used peptide, which can help stimulate tissue damage repair. So you can inject it into certain areas, and it can help to stimulate your body to repair those areas. It works great for that. Then you've got bremelanotide, PT141. It's called bremelanotide. It's a sexual stimulant. It was used originally, created for to help with self tanners. You remember those self tanners that you?
Oh yeah, yeah.
Yeah, right. They have the melatonin thing, and your hands would turn orange. I don't know if you did that, but I did it. So I would take these little pills, and your face would look kind of orangish, and your hand palms would, you look dirty all the time. So anyway, they were trying to come up with a way to give your people self tanning, and they came up with bremelanotide, which actually, instead of, it does to make you a little tanner, but the other side effect was it makes you sexually stimulated, like it's different than, say, like a Viagra and Cialis. Those work on the vascular system, right? They change the vasculature. This works on your mind, so it can be used for men and women. So it's a one of those amazing peptides that works really well. It's like when I was young, we there was something called Spanish fly, but basically that's the concept, right? So it's basically a sexual stimulant, and it stimulates it in your mind. So it'll stimulate a woman, it can stimulate a man, and so it just it's a wonderful peptide. So obviously different than the one that repairs tissue. You've got different peptides. One can help with sleep. They've got some that just really are great for just various problems. The best way to do it is to look up. You go to a site where they show all the peptides and look at the condition that you're suffering, and that'll show what peptides are usually designed for that. Some stimulate your immune system as well, so it's great for taking away, preventing sickness and things like that.
Wow, yeah, that's very, very interesting. There's a lot of research going on in peptides right now. Hopefully, hopefully we, I know the FDA frowns on them at times, and hopefully they're not going to. Yeah,
because they're effective, and
I totally get it.
Pharmaceutical companies want to take them over so that they can use drugs. They've already done it with PT141, the one I mentioned, bremelanotide. It is now a pharmaceutical drug for sexual dysfunction in women. They put it as a woman's sexual dysfunction, but it's the same peptide. It's just the same thing. But now they've got it under a drug. So these companies have tons of money, and they'll just make every peptide that they create a drug out of illegal for just normal people.
Correct. Yeah, that's kind of the story of what the FDA does. The Big Pharma and the FDA are definitely kind of created a cartel together. That's for sure, and they decrease access to patients for sure. So let's hope that patients can still keep getting peptides. So. Yeah, right. So thank you for that. That was very educational. So what else? What else would you like to share today, Dr. Carter?
Well, what I found, the thing about, I want to step back and go back to the stem cell concepts and really talk about aging. And I got to interview a brilliant man. His name's Dr. Aubrey de Grey. I don't know if you've ever heard of him. He is an anti-aging scientist, been around for more than for 20 years. So he's been doing anti-aging for a long time. And he has defined aging as really 3 words, and it makes it really simple to understand the concept of aging. You basically have metabolism throughout your whole life, right? Every day you're alive, you have some type of cellular metabolism. Metabolism over time will lead to damage. So you have a little bit of damage that accumulates as it continues to get more damage. And then eventually it gets to a threshold where your body can't handle it. And then it turns into a pathology, right? So when it becomes a pathology, it becomes a condition that you can title or label, right? It becomes heart disease. It becomes a cancerous problem. It becomes whatever. So that is really what an age-related disease is. In fact, 110,000 people a day die from an age-related disease. There's 150,000 deaths worldwide every single day, and 80% of those are due to an age-related condition. Alzheimer's, heart disease, stroke, diabetes, those things. So we have a tremendous amount of people dying from an age-related disease. One of the things I do when I talk in my seminars, I talk about the importance of trying to prevent these problems from occurring. And there are ways to do that. Most of us wait for we have a condition, and then we try to treat that condition with various therapies, but we're fighting that condition. What if the problem never occurred in the first place? Let's take a smoker. Let's take somebody who smokes cigarettes their whole life, and then guess what? They develop lung cancer. Big surprise, right? Now, if they have to do chemotherapies or surgeries or other things, and it may not even work. A lot of times it doesn't. But their lungs, no matter if it does or doesn't work, regardless, is never going to be the same as it did before they smoked, right? So what if they just never smoked in the first place? The chances that the lungs developing cancer are little to none, right? Most of the time, our lungs, for example, are able to repair themselves for the entire part of our life, except if we damage them. So what if we could repair that damage before it becomes a condition, before it becomes a pathology? And that is something called regenerative, I term it regenerative maintenance. It's preventative maintenance, like a car. If you've got a car from the 1920s, you've seen them at car shows, right? Now, those cars were designed to last, 10 years? And if they're still driving today, someone's done a lot of preventative maintenance to prevent that from breaking down, because they weren't designed to last that long. And the way they're designed, because every time you use it, it's going to cause some degree of damage. Our bodies are the same way. Every day we're alive, we create damage, minor damage, unless we have major traumas, of course. But all that damage accumulates till we develop a pathology. If we can repair the damage, especially the hidden damage, before it becomes a pathology, we're going to be doing a lot better. And that is a concept I call regenerative maintenance. By what we do is we use regenerative nanoparticles from typically stem cells. They're systemically given throughout the body. They find the hidden damages that you don't even know about because they're attracted to inflammation. They go and repair that damage, which you didn't even know you had. And then your body just continues to work. So you do it on a periodic, on a time basis. So each time you do it, it's repairing the damage that you've sustained since the last treatment. And you just keep doing that. And it keeps you in that preventative maintenance stage so that you don't develop pathology. And that is the new concept of the wellness. It's really wellness care, but it's preventative care to help prevent problems. And so we don't have to keep getting a condition and then trying to fight it. We just try to prevent it from happening in the first place, because every condition you can name responds favorably to taking down the inflammation, repairing any damage, and replacing any dead cells with new cells. Everything responds well to that. And that's exactly what these regenerative nanoparticles do. They stimulate those main three things to happen. And they can do that without you even knowing it. If you put it in an IV and you just fix problems and you never have a problem, that's what we want. So people are like, well, what am I going to feel? Well, hopefully nothing, because we're repairing things that you don't know about. It's like if you take your car in to get an oil change, do you notice it after you drive it off the lot? No, it drives the same, right? That's what you want. If something changes, then you know there was a problem that really needed to be addressed. So the goal here is to do a timely basis of regenerating any damage on a constant basis. And that's coming out in my book, Healing Your Weakest Link. And because those weak links are what kill us. Right, that's what happens.
Right. Well, I'm going to ask you this, but as I ask all my guests, but I think
Okay,
this is
go
going
ahead.
to be rather obvious. So, what drives you? What do you have what's your passion?
Saving people's lives, helping people. If we can slow the death rate from 110,000 people a day, if we could slow that down, that drives me. Or how about this? How about we look? We all get this call eventually. Most of us do. The hospital calls and says, "Hey, I have bad news. Your mother, your father, your loved one has suffered a heart attack, a stroke, has been diagnosed with a cancer. You need to get down here as soon as possible." Right? I had that call myself. Pretty much everybody will. If you hadn't had it, you're probably going to get it. But what if instead we get a call from the medical center and say, "Hey, I want to let you know about your mom, your dad, your loved one. We just did a bunch of blood work. We did a bunch of tests. They're doing great. They're healthy. They're strong. Just keep doing what you're doing." Which call are you going to want to have? Obviously, you want the secondary call, right? But if you're not doing anything to get that call, you're going to get the first call. So is it, most people will do more for other people than we will for ourselves. That's why I use an example with your parents, because you'll probably do more to help protect them than you probably may do for yourself. So think about them. Maybe they're 70-year-old and they need to stay healthy. You got to get in there and do regenerative maintenance. I literally was doing this last night with a very high-level celebrity, working on their parents, because we get older. It's not stopping aging. We're not trying to stop aging. We're just allowing you to stay healthy and strong in your hundreds. You don't want to. Nobody wants to be 120 and disabled. That's not fun for anybody. But if you could be 120 and still run a marathon and do all the activities and spend time with your friends and families and loved ones, that's what it's all about. So die all of a sudden because your stem cells run out. Okay, that's fine. You all of a sudden die. That's great. That's how we all want to go. We don't want to suffer for years because we have cancer and then it starts to invade all our parts of our body and our whole life is about going to the hospital and have treatments all the time. What if you could just prevent that with a simple IV every 3 months that doesn't even hurt and you never have a problem in the first place? What's more important? That's what drives me, is I don't want to die. I don't want to go down like that. I don't want to die like my father did, because I didn't have this when he died. I didn't know this stuff. Now I do. And I'm like, I could have saved his life. That's my bad. Now I'm working on my mom. I'm working on my sister. I'm working on myself, my wife. I mean, people around me all do these procedures because it's not for the money. It's to make a difference. And that's really the thing. So that's it. Regenerative maintenance. That's what I want to tell everybody.
Well, that's a lot, and that's good. Good for you. And so if people want more information, how do they get a hold of you?
Just go to my website, drrosscarter.com. I used to have like 20 different sites, and I just make it all on one. So drrosscarter.com, you can go there. You can set up a time to talk to me. You might want to scroll up. Basically, we'll find out if something is working for you. Because like it says there, as we get older, we suffer from chronic pain, degeneration, accelerated aging due to these hidden weaknesses in our health. And we use regenerative nanoparticles to find the weaknesses before they become problematic. That says it all right there. And that's what I do.
Well, thank you so much for educating our viewers and listeners today. I really appreciate it, Dr. Carter. You're obviously an expert in this field, and you have a big passion for this field, for helping others. And I really am glad that you have found this and found your passion so you can help others stay healthy for as long as they can. So thank you so much for being on our show today.
It's a pleasure. Thank you for having me.
All right. And as always, thank you for listening to our midweek podcast, Health Solutions with Shawn and Janet Needham. You've been listening. Thank you for tuning in. Monday, don't miss out, 12:30 to 1 Pacific Standard Time. We have a great show coming up, so don't miss out Monday. Dr. Carter, thanks again for being on.
Pleasure.
Thank you.